New tonight, President Trump declaring a national public health emergency, shining a spotlight on the opioid addiction crisis. But could this mean less money for HIV and AIDS treatments and prevention? Local advocates are worried about that possible impact on their battle. Team 12's Nico Santos is verifying if this could damage decades of effort. Nico?
Well, to be clear, we haven't met anyone who is against prioritizing the opioid crisis that we have in our country, but some are questioning why the money has to go for one or the other, instead of understanding that HIV, drug abuse, mental illness, and other issues often go hand in hand.
You should expect to see approvals that will unlock treatment for people in need.
President Trump committing to solve our nation's opioid problem, but there are skeptics.
What I would say to the president on that is, show me the money.
But there is no new money. President Trump's announcement allows states to shift current federal funds. That includes money currently going to HIV and AIDS treatment and prevention.
It's not going to be good for anyone.
Jonathan Breyer from Aunt Rita's Foundation is concerned about resources getting taken.
We are working through the addiction issues. We have case management.
Part of a San Francisco Chronicle report reads, there is some logic to tying HIV prevention programs to opioid abuse because HIV can be transmitted through reused needles. But that might be oversimplifying it, which the report also noted.
There's a huge overlap.
But not necessarily cause and effect. Heroin addicts may use needles, but the DEA says 80% of heroin users started with the abuse of opioids prescribed by a doctor. And the CDC says only 6% of new HIV diagnoses were tied to intravenous drug use.
It is a national emergency.
It's still not clear if funding will be taken from HIV, but should one come at the expense of the other?
Those are removed or redirected. I think we'll see a really catastrophic opportunity for things to go downhill.
As it is, the San Francisco AIDS Foundation says resources are scarce. So would it be detrimental to treatment and prevention efforts? Multiple healthcare agencies and advocates say yes, and that's verified. Now, opioids have been declared a public health emergency, not a national emergency, and that means that would have provided billions of dollars in new money instead of having to shift the funds around. Nico Santos, 12 News.